Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale of Two Hygienists in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola here with another Fast Facts Pharmacology Edition. Well, we started talking about cardiovascular disease and we talked about hypertension. Now let's talk about the medications that are used to treat hypertension and their effects on dentistry. Well, one of the first things we talked about, how do you lower your blood pressure? Remove some of your fluid from your plasma. How would I do that? Diuretics. But if you know that diuretics pull water from your plasma, then you know they might cause some type of systemic dehydration. And in the world of dentistry, that means potentially xerostomia. What kind of diuretics? Well, we're pretty familiar with the names, hydrochlorothiazide, furosemide, also known as Lasix. So we're pretty sure that we know that diuretics can cause xerostomia, but that also means what? The potential for opportunistic infection, like candidiasis. In addition to that, every time we use a medication that alters your blood volume, we run the risk of causing orthostatic hypotension, right? The inability to stand up quickly and move your head quickly without feeling faint. And then also diuretics on their own can cause something known as hypokalemia or a loss of potassium. Now, not every diuretic does that, but the most common ones do. So in essence, we're always watching out for our patients to make sure their potassium levels are still normal. One of the things that might escape us is the fact that we know that NSAIDs that we commonly use in dentistry can interfere with the action of diuretics because diuretics are causing you to lose water, but NSAIDs might actually make you retain water. But that effect is usually over the long term, not in the short term time that we use NSAIDs for dental pain, typically no more than 72 hours. Okay, then we talked about getting bigger pipes, dilating your blood vessels. And of course, calcium channel blockers would be perfect for that. Amlodipine, for example, Norvasc, nifedipine, Procardia. These medications produce vasodilation. But in addition to that, they also reduce the heart rate and cardiac activity. So as I said in the earlier episodes, calcium channel blockers could be used for multiple things. Of course, hypertension, but also angina and also arrhythmia. Again, since these calcium channel blockers dilate blood vessels, we again run the risk of orthostatic hypotension. I'm sure you don't have to hear this twice, but you also know that Norvasc can cause possible gingival enlargement. And there's even some side effects that make calcium channel blockers not so appealing to your patients, like constipation and even dysgeusia. So, you'll hear me say this a bunch of times. While medications to treat hypertension may be effective, the only problem is some patients just don't take them for obvious reasons. If side effects become problematic, it's easier not to take the medication than it is to take the med. Okay, what else? Well, we said angiotensin could be a problem. Now, angiotensin is a chemical that we produce that maintains our blood pressure in all sorts of situations. It's considered part of our circulatory homeostasis. But too much angiotensin could be a problem. So how to treat that? Well, ACE inhibitors, right? Angiotensin converting enzyme inhibitors. Angiotensin converting enzyme is the enzyme that produces angiotensin. Want to get rid of your angiotensin, or at least get rid of some of it? Get rid of the enzyme that produces it. And so we have ACE inhibitors, which I call lovingly the prills. Lisinopril and Ramipril, all the prills. What about patients who can't take prills? Well, why would that happen? Well, they get that weird side effect, that cough, right? So then maybe you'd want to use an angiotensin 2 blocker like Diavan or Avapro, Valsartan or Irbesartan, respectively. Well, wouldn't that do the same thing? Exactly, without producing the cough. So there are other medications we can use to control angiotensin-based hypertension. But what about what a lot of people I think have? Hypertension due to stress. Well, for that, maybe we'd use a beta blocker, something like atenolol or metoprolol, tenormin or toprol, respectively. These medications reduce the heart rate, but they also reduce the force of contraction and cardiac activity. So you guessed it. They're also useful for treating not just hypertension, but angina and arrhythmia. The beta blockers have more side effects, though. They can cause depression, fatigue, increased sensitivity to cold, and even erectile dysfunction. So, obviously, again, many patients may not take them if they believe that the side effects are too problematic. One consideration that always comes up for beta blockers is the use of epinephrine. We realize that the use of epinephrine may produce a hypertensive effect in patients who take non-selective blockers like propranolol, Inderal, or Nadolol, Corguard. This is Tom Viola with another Fast Facts Pharmacology Edition. Look forward to seeing you for the next one. Until then, be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.